Well, we begin with the breaking news out of the US. White House Press Secretary Kayleigh McEnany has tested positive for coronavirus. She's the latest among President Donald Trump's inner circle to be infected. Well, over the weekend, she gave several press briefings without wearing a mask. McEnany was one of the many people who attended Trump's Supreme Court's nomination ceremony who have now tested positive. And as for the US president's health, he's also infected with coronavirus. Doctors are set to decide in the coming hours whether Trump is fit to be released from hospital. His chief of staff says they're optimistic about his prospects. On Sunday, Trump made a surprise drive-by for hundreds of his supporters who were gathered outside the hospital. A doctor at the hospital where Trump's being treated called it, quote, irresponsible and astounding. Let's get the latest now from our White House correspondent, Kayleigh. She's outside Walter Reed, where President Trump is being treated. Kayleigh, let's start with the press secretary. She is the latest high-profile figure in the White House to contract the coronavirus. What sort of impact is this having, not just on the top team, but also on the hundreds of people who work alongside the president, the press secretary, and all these senior officials?
Well, what this is doing is introducing risks. The latest is not only a member of the White House press team to test positive for COVID-19, but also is a relative of Kayleigh McEnany. The latest confirmation we have is that a member of her press team, Chad Gilmartin, has tested positive for COVID-19. She works very closely with Chad in what's known as upper press. He is present in many of the White House press briefings there alongside the press secretary, who we also understand now has tested positive for COVID-19. And he is a relative of her husband, a cousin, we believe. Now, in terms of Kayleigh's own diagnosis of testing positive for COVID-19, she confirmed that that was the case through Twitter when she released this statement. And if you want to pull it up, we can work through it together. She says, after testing negative consistently every day since Thursday, I tested positive on Monday morning while experiencing no symptoms. No reporters, producers, or members of the press are listed as close contacts by the White House medical unit. She goes on to defend the fact that she held press briefings and says that she had no knowledge that there was a positive test result for the president's close advisor, Hope Hicks. And as a result, she not only held a press briefing on Thursday, but then held gaggles as recently as Sunday. Now, a gaggle is where she would stop in the driveway where the press corps is gathered and speak very informally, often no more than a meter apart. So again, the prospect that there was risk introduced to extended members of the press pool is significant. Now, she defends this in her statement. She goes on, with my recent positive test, I will begin the quarantine process and will continue working on behalf of the American people remotely, defending the fact that she continued to work while not knowing that she had COVID-19 because she was trying to get the latest information, she says, about the president's health condition to the American public. But in doing so, she has not only put herself at risk, but also others.
Meanwhile, many people are concerned about President Trump's health. You can see a large crowd of supporters behind you there, Kayleigh. President Trump is clearly itching to be discharged from hospital, but there's still a lot of confusion as to his current health status. How is the president, and is it likely he's going to be discharged today?
Well, we don't know because we haven't had a briefing today, Monday, by his medical team. We were told that a determination would be made today and that the president could be released as early as a few hours from now. The press pool was called to Walter Reed Medical Center north of Washington, D.C. in the U.S. state of Maryland behind me. And since then, they've been in a holding pattern, not only waiting for updates, but waiting potentially for the president to return to the White House, where he would have the opportunity to be cared for in a medical suite inside the White House. But again, we don't have any clarification on that because there has been no briefing. What I can tell you is the president is itching to get back on the campaign trail. He released a spate of tweets tweets this morning outlining his platform, 29 days and counting until November 3rd presidential election. And we know that he's watching carefully his rival, Democratic presidential nominee Joe Biden, who is hitting that coveted battleground state of Florida today, and also Senator Bernie Sanders hitting the battleground state of Michigan, two states that are badly needed by this president if he hopes to win the White House, and yet he is not able to campaign. He is still in the hospital. So certainly this is probably agitating the president, who says, according to his chief of staff, that he's feeling much better, he's positive, and he's eager to get back to the work of serving the American people. But at the same time, given his age, given some of his underlying health conditions, we know that he is still at risk for having another downturn in his health as a result of COVID-19.
OK, well, we await that briefing from the medical team. But for now, Kimberly Halkett outside Walter Reed, thank you.